Welcome back. This is Eric Roden at Neurology Solutions, Doctor of Physical Therapy, and I'm here to go over another Bosu ball training. I've had a couple now. This one's going to be done all on the floor, just to give you some ideas of what else you can do with it. A lot of people, they kind of hit this wall where they get a few moves, and they're just not really sure where to go from there. So these are some nice ones that I enjoy. There's both flexibility, strength, and a little bit of coordination. So the first two are flexibility. Again, we tend to deal with a lot of postural issues in this clinic, so we really want to try to promote opening up that chest, opening up that abdominal cavity. So we're going to set ourselves up sideways here. Get right on the edge with your butt, the tailbone there, and I'm going to roll back and try to come back as far as I can. This is a pretty aggressive stretch on my abs and my body here. If I want to add an additional dynamic to it, I can bring my arms up or even out to the side. I like them up, and I'm getting a nice stretch all the way through this anterior chain. I can stretch those legs out all the way. And I'm just getting a nice stretch. I feel this in my shoulders quite a bit, in my anterior neck. And now I'm going to come back out of that. I recommend doing that at least a couple times, holding that as tolerated. You might have to build up to it. A lot of our patients, we start with the lower number, and then you work your way up, just because, well, your body hasn't been in that position for quite some time, maybe even years. Another common area to get tight is in the ribs and just that whole lateral area. So we're going to do a lateral line stretch. So we're going to come into this sideways. Get your hip kind of right on the edge here. The top leg is going to be straight. The bottom leg is going to be bent. And we're going to arch over this. And I'm feeling a nice stretch through my abs, my ribs, those obliques on the side there. I can let my head drop. I'm going to feel that on the lateral neck. And I'm just going to get a nice stretch here. Again, do this both sides, minimum 2 times each. Let your body adjust to that stretch. I normally even recommend 3 if you can, if you have the time. All right, we're going to come back out of that. So those are 2 nice, easy, simple stretches. There is a million more to do, but I really like those 2. Definitely a fan of them. Next one is going to be a coordination drill. This can be done with the blue side up or the black side up. I'll demonstrate with the blue here initially. You're just going to sit on it, okay? Try to get right in the middle there. This requires a little bit of balance, a little bit of core, and definitely a lot of coordination. You're simply going to march. So your hands initially, version 1, I'm going to hold on to the ball, and I'm just going to try to pick up my feet. It seems simple enough, but with that compliant surface underneath, a lot of times, whoop, you want to fall over. So I'm going to hold the ball, first version. Version 2, my hands are going to be out. Version 3, I'm going to move my arms opposite of my legs, just like if I was walking. So it's like a seated march, but on the Bosu ball. Now, black side up, or gray side in this case, gray edge. I'm going to try to get in the middle. This is a little more challenging because I got a lot more wobble here. And again, I'm going to go right to the level 3 version. And you can see that added challenge, that added wobble. So this is rotational stability. So my body wants to rotate and I have to try to stabilize it. Really, really a great drill. Good for bed mobility, trying to adjust in bed, just getting out of a chair. Really, really great, and that coordination challenges the brain. All right, we're going to move on. Next one is going to be added on the strength world. Just a good old-fashioned push-up, but utilizing the Bosu ball adds a new dynamic, a new intensity to it. So you can start on your knees. That's probably the easiest version, okay? Maybe put a pad underneath there in case you have knee problems. And your new push-up. Now again, if you have one side that you bias towards versus the other, it's going to want to lean. So you're going to end up like this. Try to keep it right in the middle. Full version, obviously, all the way up. You're going up and down, as many as you can, or even just a plank hold. Holding that position. If you want to get real fancy, you can actually lift the legs. That adds a lot more shoulder stability and core strength and activates those glutes, meaning your butt muscles there. Okay? Nice drill, big fan of that, definitely use those. Next one I'm going to do is the bridge, okay? You've probably been given this countless times through your PT adventures, whether it be with us or other PTs. Our legs are going to go on the Bosu ball, so it's going to elevate it and make the bridge a little more challenging because we have a greater range of motion to go through. The ball adds a little instability, but not too much. Arms are down, and we're going to lift up. And you want to try to make a straight line with your torso and your thighs, and then come back down. You don't want to overarch, so I don't want that low back really arching. You're going to cause pain there. Now if you start cramping in your hamstrings, get your butt a little bit closer to your ankles there, and that actually will help with the cramping. I should be feeling this in my butt primarily, a little bit in the hamstring, and maybe just a smidge in the back, but not primarily. We definitely want to avoid that whenever you can. All right, the next idea for you, which I think is a great one for your bed mobility training and core stabilization, I call it the partial get-up. Kind of the first step of a Turkish get-up, if you've heard of those. I have a tutorial on that. Is you're going to use the Bosu ball to help you get up from a supine or on your back position. So it takes a little bit of adjustment to get that up there. So basically you're kind of laying sideways a little bit with the Bosu ball right underneath that shoulder blade. The goal, you're going to bend that same side knee, that arm's going to come up, and you're going to try to pop up onto that elbow and back down. Pop up onto that elbow and back down. What the Bosu ball does is it basically reduces the range. So instead of full range of motion, trying to get up, this practices the short range, so you get some success with that movement pattern, and then as time goes on, you get better at it. Really, really important for bed mobility, having that cross-body strength and coordination. Big fan, works great. Again, there are countless other exercises. I just wanted to give you a little breath, some ideas that you might like. Again, make sure you consult with your therapist or trainer before you do any of these. If you don't have one, come see us. We'd love to help you out. We'll see you next time.